Go animate, make your free animations. Go animate, make your free animations. Yeah!
Hello, Dr. Ross. I discharged the patient as you told, but I have a question.
Hello, John. Thanks for your help. What's your question?
I'm still not sure about the exact definition of prediabetes. Could you please explain it for me?
Yes, of course. Prediabetes means that patient's blood sugar level is higher than normal but not so high to be considered as diabetes.
So how we can diagnose prediabetes?
We use different tests to detect prediabetes. One of them is fasting blood sugar, or FBS, in which your blood sugar is checked in the morning after an overnight fasting. Normal blood glucose is less than 100 mg per deciliter. Prediabetes is defined as FBS between 100 to 125 mg per deciliter, and diabetes is defined as fasting blood glucose equal to or more than 126 mg per deciliter.
Are there any other tests?
Yes. The other test which is used is oral glucose tolerance test, or OGTT. In this test, after an overnight fasting, you are given a glucose-rich solution.
What happens next?
2 hours after drinking that solution, your blood sugar is measured. Values less than 140 mg per deciliter are normal. Values between 140 to 199 mg per deciliter are in the prediabetes range, and values equal or more than 200 mg per deciliter are in the diabetes range.
May I ask another question?
Yes, sure. I'm glad that you are so interested in this important metabolic problem. As you may know, it's a growing health issue.
Thank you, Dr. Ross. My question is about hemoglobin A1C. What is it? And what is its significance?
Hello, Dr. Ross. Hello, John. I heard that you were talking about prediabetes. Do you mind if I join the discussion?
Not at all, Dr. Norman. I was going to explain the significance of hemoglobin A1C for John.
That's a very interesting topic with many practical implications in diabetes and prediabetes management.
Exactly. HbA1c shows the average amount of the blood glucose over the past 3 months.
Yes. It shows us the long-term blood sugar control. In contrast, blood sugar measurements only give us a snapshot of the patient's blood sugar level. John, do you know the normal level of the HbA1c?
Yes, I think the normal hemoglobin A1C is less than 5.6%, but I guess it should be higher in prediabetes.
Yes, you are right. The values are higher in prediabetes and diabetes. In prediabetes it is between 5.7 to 6.4, and diabetic patients have a HbA1c equal to or more than 6.5.
What's the relationship between prediabetes and diabetes?
Many people with prediabetes develop diabetes. The risk of progression from prediabetes to diabetes is approximately 25% over 3 to 5 years.
Also, people with prediabetes are at increased risk of diabetes complications, such as heart problems.
John, do you think whether the prevalence of prediabetes is different for various age groups?
Honestly, I don't know. But the frequency of most metabolic problems increases with age.
You are completely right. The risk of type 2 diabetes increases as you get older, and for that reason, the Canadian Diabetes Association recommends all adults check their fasting plasma glucose when they reach age 40 and then every 3 years afterwards.
If you have diabetes risk factors such as prediabetes or positive family history in your first-degree relatives, you should be tested earlier and more frequently.
Where can I find diabetes risk factors?
You can find diabetes risk factors on the Canadian Diabetes Association website.
Is there any way to prevent the progression of prediabetes into diabetes?
Yes, fortunately there is. The first step to prevent or postpone the progression of prediabetes to diabetes, or to postpone diabetes complications, is lifestyle change. Lifestyle change includes eating healthy diet and increasing physical activity.
Exactly. The American Diabetes Association or ADA guidelines recommend modest weight loss or losing 5 to 10% of total body weight. Moderate intensity aerobic exercise for at least 30 minutes 5 times a week, and smoking cessation. You can find more information on the Canadian Diabetes Association website.
What if lifestyle change doesn't work? What we should do next?
If lifestyle modification fails or in those who are at high risk of developing type 2 diabetes, medications such as metformin and acarbose can be used.
It's a very interesting discussion, but I have an appointment with a patient in 10 minutes, and I have to leave. Goodbye, Dr. Ross. Bye, John.
Goodbye, Dr. Norman. John, I have to leave now. Why you don't come to my lecture on pre-diabetes next Tuesday?
I'll definitely come to your lecture. This discussion made me even more curious. Thank you for your time.
You are very welcome. Goodbye.
Goodbye. I should study harder.